Welcome back to Daytime, everyone. I'm Cindy Edwards. Have you put your sunscreen on today? Hopefully it's become part of your daily routine, because every hour someone in this country dies from skin cancer. Dermatologist Dr. Robert Norman is here to tell us more about this. Nice to have you here.
Thanks.
Let's talk about the stats on skin cancer. Every hour an American dies. 1 in 3 Caucasians will be diagnosed with skin cancer in their lifetime.
Correct.
That's incredibly high.
Yes, very high, right. About more than 1 million people get skin cancers diagnosed a year, more than any other cancers.
And is it mainly just the sun?
About 90% of it is related to the sun.
Okay, well, obviously prevention is the key. Get your kids started very, very early, right?
Absolutely.
Start slapping it on when they're just still infants?
Anytime after 6 months old. Prior to 6 months, we don't really have good statistics as far as, the safety of it, but after 6 months, definitely.
Okay, prevention is key. Also being able to recognize when we've got some risk factors on our bodies. You had a screening at your office recently. Tell us about that.
Exactly. We had about 72 people come in 3 hours, and we had multiple skin cancers diagnosed. In fact, towards the end, a gentleman came in and had been waiting a year to come in, and he had a melanoma. It was fairly obvious. I actually removed it right then and there because he wanted it off. And he had multiple other skin cancers, and that's remarkable when people come in. That's sort of the main purpose of those skin cancer screenings, is to have something like that happen. And it was actually, the good bad news scenario. It was great that he came in.
I've often wondered, is it worthwhile to just get all your moles removed, because then they might not turn into skin cancer?
Well, we don't know what's going to change over time, but it really, cosmetically and every other way, and financially, it's difficult to get everything removed. But so what we do is we look at the ones that we're most suspicious about. There's lesions called dysplastic nevi, and they're a little bit darker, more irregular. Those are the ones we want to take off so that they don't turn into anything later on in life.
Something called the A, B, C's, and D's of skin cancer.
Correct.
Tell us how does that
The
explain
A,
that
B,
for us.
C, D's. A stands for asymmetry. It's an irregular border. Is B for the border is irregular also, and they're not a normal round mole, in other words, that you'd see on an everyday basis, sort of a garden variety mole. The C is for color. There are multiple colors to it. It can be brown, purple, multiple colors that would lead you to suspect that's abnormal. And D is the diameter. It's greater than the size of a pencil eraser, more than you'd see in a normal sized mole a lot of times. So that combined, you have to look at the whole picture. And sometimes we add on E for elevation. It's elevated more. It's a little bit discolored. In addition, a lot of other signs as far as bleeding and other irritation and things like that we add into the mix. So it's sort of an overall picture that we look at.
And as soon as you see something like this, get to the doctor immediately.
Exactly.
Now, will your regular doctor just recommend you going to a dermatologist, or can your regular GP just take care of it for you in their office?
Right. Most of the studies show that it's better to go to a dermatologist. Nothing against the primary care doctors. I love them, but this is what we do all day long. So if you can have access to a dermatologist in your area, I recommend that.
Now, I brought this out here. I apologize, because I know you probably might not be familiar with this particular brand, but it's Bethesda soap, and actually our Aging Backwards guru, Jackie Silver, brought it on. It's a sunscreen soap. Okay. So when you're washing in the shower, you're actually putting a film of sunscreen on. Do you recommend something like this?
I recommend anything that adds sun protection, whether it's soaps or lotions, and anything that avoids too much sun. Sun is to skin cancer like cigarettes are to lung cancer. So the least amount of exposure you can, the better.
What about our heads? We often we slather the sunscreen all over our bodies, and for some reason think our hair might protect us. Do you see a lot of moles or anything on the scalp?
Well, sure, you can get it in any part of the body, so it's very important that that's protected too. For the older gentlemen that I see a lot in my office, that they need to wear a hat. They're out in the sun a lot, playing golf or whatever sport they're in. They need to be protected.
And ask
they can't see it as well,
right.
Obviously, so they have to, they have to come in to see us and say, okay, that might be suspicious. So that's another reason why it's important to see your dermatologist.
And a lot of times, if you've got one on your back, you might not know it too. So watch for your loved ones as well.
Exactly.
Right? Keep an eye out. Well, thank you very much for joining us today.
Sure.
And just get there. Don't wait. Right. Just take care of it earlier.
Yeah, and the key is prevention. Before the age of 18, about 80% of our sun damage occurs, and the skin is sort of like keeps a diary of itself, a record, and over time, it causes more and more damage. So even if you've had damage, stop now and prevent more. And avoid tanning beds by all means.
Okay, you heard it from the doctor, Dr. Robert Norman. Thank you very much for coming in today. There's a lot more Daytime coming up, so stick around.